Hello, everyone. Thank you so much for joining us today. We are so excited to have you here. A couple of housekeeping announcements before we get started. The California Labor Lab is accepting applications for pilot research funding to support research aiming to understand or enhance worker health. Awards of up to $15,000 are available, and applications are due on January 17th, 2025. I'm going to go ahead and put a link to that opportunity in the chat. We also invite you to save the date. The California Labor Lab's annual conference is going to be on Tuesday, April 29th to Wednesday, April 30th, and it'll be virtual. And our theme is on art and work. So we hope to see you at our annual conference. And on behalf of the California Labor Lab, a NIOSH Center of Excellence for Total Worker Health, it's my pleasure to welcome you to the webinar today. A few housekeeping items. You are going to be muted during this presentation. If you'd like to ask a question, please enter it into the online Q&A, and we'll save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the California Labor Lab and Center for Occupational and Environmental Health YouTube page within the next 5 business days. And all participants who logged in with their registration email for the full live presentation today will receive an email tomorrow with a link to an evaluation form that will qualify participants for a certificate of completion with 1 continuing education contact hour. Once the evaluation has been completed, you'll be able to access and print your certificate. It's now my pleasure to hand it over to Dr. Christina Banks.
Thanks so much, Michelle. It's great to have everyone here today, and quite a group we have, I must say. It's my pleasure as moderator of this webinar to introduce to you Dr. Gina Solomon. A brief bio before she starts. Dr. Solomon is the chief of the Division of Occupational, Environmental, and Climate Medicine at the University of California, San Francisco. At UCSF, Dr. Solomon oversees clinical occupational health activities at 3 hospital sites, leads research efforts in environmental health, and directs the Occupational and Environmental Medicine Residency Program. Prior to this, Dr. Solomon was a program director at the Public Health Institute in Oakland, California, where she established and led the Achieving Resilient Communities project to identify, test, and expand actionable interventions to reduce climate change impacts in farm worker communities. Prior to that, Dr. Solomon served as the Deputy Secretary for Science and Health at the California Environmental Protection Agency. She was a senior scientist at the Natural Resources Defense Council from 1996 to 2012. Dr. Solomon has served on multiple boards and committees of the National Academies of Sciences, World Health Organization, U.S. Environmental Protection Agency, Centers for Disease and Control and Prevention, Bay Area Air Quality Management District, and other federal and state agencies. Dr. Solomon received her bachelor's degree from Brown University, her MD from Yale, and did her MPH in residency and fellowship training in internal medicine and occupational environmental medicine at Harvard. It is my pleasure to introduce Dr. Solomon, who will talk about climate change and environmental degradation impacts on worker well-being. You have the floor, Dr. Solomon.
Thank you so much, Christina, for that lovely introduction. Thank you, Michelle, and thanks to Ed and the California Labor Lab for inviting me. I'm very happy to be here today, and it's a somewhat odd juncture and difficult juncture to be talking about climate change. We are on the cusp of some changes, I think, at the federal level, and also we're really seeing some major climate impacts in our world around us. And so it's, it's a challenging time that we are in and that we're facing. And I think there's a lot that we can be doing around impacts of climate change on worker health and well-being. So that's what I'm going to talk about a bit today. This schematic from the California Department of Public Health is, just sort of shows some of the key issues around climate change, which is that climate change impacts our health sort of through several lenses, through more extreme weather, higher temperatures, higher levels of greenhouse gases, and rising sea levels. And then those in turn have ripple effects and other effects that you could see all around the outside of this slide. And today I can't talk about all of these things, so I'm going to be highlighting initially severe weather and floods, because that was how I got introduced to the topic of climate change and health. I'm going to then talk a little bit about extreme heat, because that's something that we all need to know more about. And I'll mention wildfires and wildfire smoke. And then I also want to just draw your attention to the upper right-hand corner here, because one of the things that we're going to be talking about during this hour, and that is very true of climate change, is that it always falls worst and hardest on people who face other social inequities and other hazards. So we see that in the worker space very strongly, just as we see it in the communities that are hardest hit by climate change. And so we'll talk a bit about vulnerable workers today. And so starting bottom line up front, some of the key takeaways. Climate change in and of itself, it's a thing, but it doesn't create any new occupational hazards that don't already exist, right? It magnifies existing hazards. Heat is already a hazard to workers. Heat is magnified by climate change. There are all the other things that I'm going to be talking about today are just, it's a threat multiplier. It magnifies what already is there. So it's not in and of itself a new thing, just something that's driving everything in a bad direction. And some of the effects of climate change are very predictable. I keep mentioning heat, very, understood. But then you start looking more closely and you realize that there are other outcomes, health outcomes, that might initially be harder to discern. So I'm going to be talking about some of those as we go through it. And then I'm going to be talking and highlighting certain worker populations: first responders, disaster volunteers, workers, farm workers, or agriculture industry workers, construction and low-wage immigrant workers, some of the ones that are most, most typically on the front lines. I also just want to talk, and my first example touches on this, is that occupational and community exposures can blur and can magnify each other. And so in our field, we think about both worker and environmental health, and this is a place where it's really important to realize that people are situated both in their job and in their community. And obviously, again, another theme is that workers need to be involved in all of the solutions, or else they're not going to tend to work. And so we really do need to make sure that there is that engagement. So let's start by talking a little bit about flooding. I first got involved in climate change work during a flooding event. So I tend to start with this. And it's also important because when you look at natural disaster fatalities, hurricanes and floods are two of the top issues. Wildfires also very significant source of fatalities. So we do see acute worker injuries and deaths from hurricanes and floods. This is what I saw when I went to New Orleans. Hurricane Katrina hit in August 2005. I was then at the Natural Resources Defense Council working with some groups down in New Orleans. Everybody ended up displaced, evacuated, scattered. And I was trying to reach people and saying, what do you need? And all of the community contacts were saying, can you get down here? Can you do an evaluation? of environmental hazards. Is it going to be safe to go back into our communities? And so I went down in September 2005 and took these photos during the time I was down there. And it just shows the power of the floodwaters. You kind of think about waters rising, but the floodwaters roar through. And we've seen this kind of footage more recently in North Carolina and in southern Spain, where there's been acute flooding. Oh, and very, very recently in Greece. Enormous destruction from flooding. And the destruction also result in flooding of various other kinds of sites. This shows a gas station down on the lower right, resulting in contamination of, or potential contamination of floodwater. And, you know, so I don't really like this complicated diagram, but I wanted to show it to you for a reason, which is that, you know, there's the immediate things with a hurricane or a flood, the power of the storm surge, the howling winds, the heavy rains. Then, you know, secondary issues, power goes out, then that, you know, run into secondary problems as a result of power outages. Can also end up, I didn't show a picture of this, but we saw drinking water basically bubbling up through the pavement on the, you know, the streets in a number of different places, which showed disruption of drinking water lines underground, and sewage lines also were similarly disrupted. And then you end up with contamination getting into the drinking water system, which can cause, again, a whole set of ripple effects. People who are displaced may end up with all kinds of health outcomes as a result of that displacement, the stress, the interruption of healthcare, loss of medications, et cetera. Oops, sorry. And then exposures related to direct contact with floodwaters or sediments left behind by the flooding. And then all of those, again, have additional ripple effects. So it's layer upon layer of health issues that can get kind of complicated. And I could actually add a lot to this diagram if we, you know, if we wanted to. But it just shows it's not a simple thing, and you do have to think about all those different components. It also, all the workers are in the middle of all of these. So they're dealing with the displacement and the destruction of their homes while at the same time potentially working. One of the things, these are also pictures I took, you know, one of the things that was most notable down there after the flooding was the stench of mold in the flooded communities. It was really rather overpowering, actually, and unexpected to me at that time, even outdoors. And then if you looked into homes, you'd see this very thick, plush, furry growth of multicolored mold on the walls. And that was really the source of the odor and the, you know, that question that people were asking of, well, was it safe for people to go back? And at that time, there had not been flooding events like this. You know, most of the major hurricanes that have resulted in large floods have been since Hurricane Katrina. So at that time, we were starting to ask questions about mold, and really none of the agencies had any guidance. They did not feel that mold was a big issue. And we got curious, especially because of the questions from the community and the extent of the mold. So we were hearing things. One of our main partners was called the Deep South Center for Environmental Justice. We worked with them a lot. They wanted to know, is it safe to go into their homes? Did they need PPE? So these were not worker questions. These were community questions. And they wanted to know what remediation was needed. They also asked questions about the sediment and the drinking water. I won't get into those, but we did studies on those as well. Be happy to talk about those in the Q&A if people are interested. But we were able to get a hold of some spore traps from University of Colorado. Got a team down there, and we did monitoring. You can see the yellow boat battery. These are there was no power in New Orleans at that time, so we had to use marine batteries to power the equipment. And we tested outdoors, we tested indoors. This is indoors, a home. This was several months later that had been gutted. And so this was in the category of full remediation. And to get to the bottom line, but because I want to get onto some other things, we found elevated levels of mold in all of these settings. For context, this yellow line shows the level that the National Allergy Bureau considers to be extremely high for mold levels in the environment. And so you can see that even the outdoor air was extremely high in the flooded areas. But the indoor in these homes was extraordinary. And one of the questions we were answering here, and this it shows the bar at the middle saying some remediation, was that some of the insurance companies were saying, well, if you just go in there and scrub the walls with bleach, your home will be fine to reoccupy, and we'll give you $10,000 cash if you do that. So we were investigating whether that advice from insurance companies was good advice or not such good advice. And our conclusion based on these data were that it was not such good advice, and that full remediation, such as you saw on the prior slide, was more advisable. However, somebody had to do that full remediation. And one of the things that was extraordinary after Hurricane Katrina was that there was an influx of between 10 and 14,000 estimated workers, mostly Latino, mostly from Mexico, some from Central America. Many of them had already been in the US. They were, coming from Texas and other areas, and because there was work to be done, which there was. So most of the cleanup was done either by people who were either doing self-cleanup, so they were trying to sort of get everything out of their own homes and clean it up, or there were some volunteer workers doing cleanup, or in a lot of cases it was these immigrant, mostly, about a quarter of the workers were undocumented, and they were doing the brunt of the cleanup work. Berkeley Human Rights Center did 3 reports on this phenomenon that are really excellent and that really trace over several years what happened along the Gulf Coast. And it was really a lot of wage and labor violations, but also a lot of health hazards that were faced, and questions about whether people had the personal protective equipment that they needed in order to be dealing with these kinds of situations. So there was a study that was published a few years later on respiratory health effects in construction industry workers. Most of these were not actually the population they studied were not actually mostly these undocumented immigrant workers. These were actual, construction industry or maintenance custodial services workers who were mostly documented and employed by larger companies, not sort of smaller companies. But as you can see here, that the number of hours of post-Katrina work in these sectors was associated with increased rates of reported cough, sinusitis, and even some indications of asthma and pneumonia in this population. There were also some abnormalities on pulmonary function testing that were associated with increased time in this this type of work. So not what I would call surprising, and probably an underrepresentation, because these were probably the workers that were more likely to have personal protective equipment, and to have the full training that they might have needed to work under these circumstances. And I also just want to, before wrapping up on flooding, just switch gears a little bit just to mention mental health issues. This was also an area that was really kind of, it exploded into public awareness with Hurricane Katrina, and now has been seen after all different kinds of disasters, many climate disasters, including wildfires and other floods and hurricanes. Mental health issues are very serious and often have to do with not only their job experience, in other words, whether they were facing personal risk of injury or exposure to trauma, but also to their own personal experiences that were happening in parallel. So many of the first responders, for example, potentially lost loved ones, lost pets, lost their home, or were displaced as a result of the storm, and were dealing with their own stresses while also having to do their job. They were also dealing with significant financial insecurity as they, potentially, battled with insurance companies or attempted to get support from FEMA for covering some of the losses. And then people, obviously all the routines shift, enormous level of exhaustion and lack of sleep. And so there's multiple studies in this worker population really very heavily affected. I think fewer studies in healthcare workers, and healthcare workers are a little bit less out in the streets, but are do face a similar increased risk of mental health issues, not quite as severe as the first responders. Just want to note the prevalence of post-traumatic stress disorder and depression in these studies, in these populations, really, really high. About a quarter of the workers experience one or both of these things. And so that is something where, there's a lot that we need to be thinking about in terms of how do we prevent, knowing that this is a big risk factor, how do we do a better job of prevention? So some lessons learned. Mold is a problem after flooding. Seems super obvious now, was not obvious back then. But it is now something that there are a lot of now protocols and educational materials and so forth about appropriate PPE, appropriate remediation. You can see these folks, they were actually trying to help her mom out with going through this house behind them, and they picked up all of this gear at a station that a number of volunteer groups had set up. So what ended up happening in New Orleans was that various NGOs basically got Tyvek suits and gloves and N95s and started handing them out on street corners to people, which is a little ad hoc, and it wasn't always, things weren't always worn correctly or appropriate, but it was certainly better than nothing. I think now we're getting, whoops, sorry, it keeps flipping. Getting a little bit less ad hoc with current disasters, but it still does tend to be very during disaster situations, a lot of things kind of go out the window. And so people are trying to do the best they can under very difficult circumstances. Okay, so let's move on. Let's talk a little bit about heat. And in the setting of heat, I want to highlight agricultural workers, especially immigrant farm workers in California and other states, very much at highest risk. These are California projections. on the left, so a bit California-centric in this part of the presentation. Daily temperature, annual maximum daily temperature is going to be increasing. This is in the Fahrenheit scale, 5.6 to 8.8 degrees Fahrenheit, depending on the greenhouse gas emissions scenario that we end up following. I'm not optimistic that we're going to be right at the low end at this point. And what that means is just a lot more hot days, especially in the shoulder seasons. I was in the Central Valley in October, thinking we actually thought that it was going to be cooler by then. And so we were, for a study that we're doing, we were removing some of the equipment. And we're second week of October, and it was over 100 degrees. And so you start seeing this issue where it's not just in the middle of the summer, but even in the spring and fall, where there are severe heat problems. And it is the #1 cause of weather-related deaths. So very much front of mind when you're thinking about mortality and severe outcomes like that. Farm workers, obviously at very high risk. If you're working out in the sun, it gets way worse. And then if you're happen to be wearing any kind of protective clothing, for example, if you're maybe in contact with irritant crops, or you might be in contact with pesticides and you have to wear coveralls, it can increase the perceptive, the temperature that the person is experiencing very significantly. So a lot of risks there, and a lot of deaths that have happened. Really horrible situations. Can read about many of these people who were, who died when they were at work doing their job. Many of them farm workers, working in the cornfield, working in there, and can't remember what Miguel Angel Guzman Chavez was doing that day, what crop. And then, but not only farm workers, postal worker in Los Angeles died a few years ago. And then this 17-year-old farm worker who collapsed and died working on grapes in Lodi was someone who I think really mobilized the community in California. There were protests, there was a lot of attention. It was really horrible. She was pregnant at the time. The entire community rose up, as they should, to demand protections. And it was, as a result of that, in part, I think that we got stronger heat standards in California, which is, not enough to make up for this woman's death, but certainly something that may be preventing many illnesses and deaths now going forward. And you could see that it's not like there's any consistent trend over time, sort of varies year to year. Over the last, we don't have, I wasn't able to find data going back very far, but sort of, between about a low point of about 20-ish deaths to about 60 deaths per year that are known that are caused by heat. Now, that is the tip. Now, I don't want to use the tip of the iceberg metaphor because we're talking about heat here, so the icebergs would all have melted, but really is not I think most of the deaths and severe illnesses from heat are not recognized as such. And I'll talk a little bit about why in just a moment. Before going more into all the different kinds of things that can be caused by heat, I do want to just do a review for everyone, since we all should know this, about heat-related illness, really 3 categories of strictly heat-related illness before we branch out. Heat cramps, heat exhaustion, and heat stroke. Heat cramps, many people on this call may have experienced them, where you sort of get a stitch in your side, typically, or other muscle spasms. It's often because of electrolyte disturbances. Runners get these, or athletes, from heavy sweating in the heat. Relatively easy to treat, sports beverage or drinking something, stopping the activity, getting cool, not, that's easy enough. Heat exhaustion, people are often, their skin is often sort of cold and gray and clammy. They're dizzy, lightheaded, pouring sweat, feel crummy, their head's throbbing. May not have a lot of insight into the fact that they're getting dehydrated, but they feel not good. So if you see somebody in that kind of state, you need to get them into a cool environment and get them something cool to drink. Because one of the key things about heat-related illness is as it gets worse, people get more confused and they don't realize themselves what's going on. So the key issue with preventing heat-related illness in workers or in each other is to keep an eye on other people, because you may perceive it before the other person does because of the mental effects of heat. The thing that we all want to avoid is heat stroke. Very dangerous. People's skin typically is dry. They are no longer able to typically sweat, often because they're quite dehydrated by that point. The skin is hot to the touch, often reddish, and they are notably confused. This is what turns quickly into seizures and collapse. Their core body temperature is getting up to a point where starting to denature proteins. And so people can die very quickly, and you need to get them to an emergency department as fast as possible. And this is obviously what happened ultimately to the folks who I talked about on the previous slide. And it can happen fast. But as I said, it's the tip of the iceberg. There's the primary effects of heat cramps, heat exhaustion, heat stroke, but then there's other effects. Anybody with any issues with their kidney function, heat is an enormous strain on the kidneys. And so, similarly, anybody with any underlying cardiovascular disease or cerebrovascular disease is at much higher risk of a cardiac event or a stroke. And so I worked with some folks on a study looking at one of the heat waves that we had in California a few years ago. And the biggest increases in emergency department visits and hospitalizations was not the stuff at the top, was not heat cramps, heat exhaustion, or heat stroke. It was kidney disease and cardiovascular events and strokes. Was what caused the biggest bump, and they were very significant increases in emergency department visits and hospitalizations during the heat-related period compared to other similar time, not during a heat event. So definitely need to think about those, and those are not typically counted as heat-related illness, which is a mistake. And that means that we are systematically undercounting the severity of heat on people and workers. And this would be the same kind of thing with workers' comp. Oh, they had a heart attack. Well, yeah, they had a heart attack. It happened to be 95 degrees. It's not a coincidence. And the tertiary health effects are also important. There are big bumps in violence, suicide, homicide, altercations of all types when it's hotter. All kinds of work-related so-called accidents or work incidents, those increase, and whether it's driving or operating equipment. People don't think as well, don't think as clearly, and they get more irritable and impatient when it's hot. You've probably all experienced this in yourselves, and it's really true of everybody. Depending on what medication somebody is taking, they may be at higher risk. And so that's always something that can put, people's hydration status, their, other health issues and their, drugs that they might be on can cause effects. And then adverse pregnancy outcomes, mostly premature birth and low birth weight have been documented in some number of California studies during heat events. And interestingly, interacting with things like air pollution. So we, with all of these, I'm talking about heat, but cardiac events, strokes, adverse pregnancy outcomes. If you happen to have heat and wildfire smoke, or heat and, high ozone levels, which often run together, you can see interactions that increase the risk even more. So just a photo I took down in the community of Lamont, south of Bakersfield. Here on the right, Cal OSHA is out there with their advertisements telling workers that their bosses must provide water, shade, and rest, and that they have a right to it, and that here is a phone number that they can call to report if their employers are not obeying the heat standard. That is great. California does have model heat illness regulations for both indoor and outdoor environments now. This is sort of the broad outlines of what's in those. Every employer has to have a heat illness prevention plan. They have to provide clean drinking water. It should be cool as well. That's not always quite done. There need to be places where workers can go where they get shade and can cool down. There needs to be a program for monitoring workers for heat-related illness, procedures that go and kick in for high heat, and for emergency response. And then very important, people who have not been acclimatized to working in the heat must have a 14-day acclimatization period where they're working shorter periods of time or less strenuous work during that time period. And that's critically important, and training, of course. There are a few more things. There's been a lot of activity in Sonoma County, which put in place a disaster pay fund. It was about $3 million to help pay for when it was, there's a climate event and farm workers can't work, they could still get paid. And that kind of thing is really important and positive because it allows, right now there's this problem of, okay, oh, it's too hot, go home, don't work. Well, then, then if the workers aren't getting income, they're not going to be, that's a problem there. Actually, the workers often will oppose policies like that, which because it puts them in too much of a bind. Changing working hours is something that can also be done. So people work earlier in the morning or during the night. But again, that can put people, create problems for people if they have kids that they're trying to care for as well, or other things that make it hard for them to change their hours. Then there is a bill that creates some presumption around heat-related illness for farm workers, which is a step in the right direction. A lot of experimentation into cooling garments. One of the other big issues is this piece rate versus hourly. A lot of the workers in, for example, berries are often paid by, how many containers worth of strawberries they pick, which incentivizes working faster and not taking breaks. Whereas if they're paid by the hour, that does incentivize taking breaks. And so some of those incentives could also be shifted. Hazard pay I put here at the bottom, super controversial. I don't feel comfortable with it but there is an effort in California to pay workers more if they're dealing with working in hazardous conditions. That I get it, but it also can create a perverse incentive where workers, more likely to agree to go work when it's too hot or when the air quality is poor or when there's some other hazard. So that is can be a challenge to decide, to think about that issue. We can talk about that more at the end if people are interested. Just to talk briefly about federal OSHA and about the situation in other states, a little less good. There was an investigation a few years ago, just mentioned this study from 2018 in the Journal of Occupational Environmental Medicine, 38, there weren't very many actually, Fed OSHA investigations involving heat-related illnesses. These were usually clusters or fatalities or very serious. Fed OSHA often doesn't go out and do heat investigations, but when they did, they found that none of the employers acclimatized new employees. None of them enforced rest breaks. Only 10% of the employers monitored the worksite temperature, and about a third provided any kind of heat safety training. So that's discouraging, to say the least. And now there are laws in Texas and Florida that prohibit these protections. So workers in other states, and pretty hot states at that, are really in danger, in my view. Briefly, to talk about wildfire smoke before wrapping up, I wanted to just again mention farm workers, because that's a population I've worked with a fair amount. And again, this is something where, when it's hot or when it's smoky, it's the case at work. It's the case often at home as well. People are exposed 24 hours a day, and that can become cumulative. And so that's a problem in terms of increasing the risk of illness. And similarly with wildfire smoke, workers are often working in the heat and smoke. And then what happens? You put an N95 on to try to reduce your exposure to smoke, but it's very hot. So you get exposed, you can increase your risk of heat-related illness by trying to reduce your risk of, breathing in unhealthy levels of smoke. And so these are some pictures from Ventura County, where that ARC project that Christina mentioned started. And we worked with farm worker groups in Ventura County, doing, sort of getting their concerns and perceptions about smoke, and their suggestions about what they thought needs to be done, what they thought would be useful for them. And this was really kind of inspiring to see that they really had a lot of ideas and a lot of suggestions. And some of these suggestions now have been implemented and have been actually pretty effective so far. One of them is an emergency response information system. The farm workers were told, okay, so we understand that levels, air quality index levels of 150, above 150, we're supposed to be able to get a mask. The employer is supposed to provide a mask, a respirator for us to wear. But, they wanted to know, they wanted to be informed themselves and not count on their employer to inform them. And so the Ventura County Air Pollution Control District put in place initially text alerts in English and Spanish that farm workers could sign up for, and they would get the alert when the air quality hit the threshold. But then they raised some more concerns, which is that some of the farm workers were not very comfortable reading Spanish, certainly not English and not even Spanish, because many of them Their first language was Mixteco or Zapoteco, which are indigenous languages, not typically written languages, and they did not really want to get text messages. So the idea came up of pictograms, which you see here, and also audio alerts, where they could receive a message that would actually play a recording of someone speaking in Mixteco or Zapoteco, depending on what they signed up for, that would explain about the air quality alert. And the advocacy groups, the nonprofits in that area were able to get get farm workers signed up for these alerts, and they've been operating since that time. So this shows some of the messages that people can get, and they can just click on the link and hear the recording. And so this is the set of groups down in Ventura County that's been working together on this. Public Health Institute's still working on it. The main groups are the Mixteco Indigenous Community Organizing Project and a group called Líderes Campesinas, which is an amazing group of farm worker women all across California, and with a very active group in Ventura County. So those were the partners. So just to wrap up, just like with climate change, the health effects are not different, and the hazards are not really that different. The general principles also apply. So the occupational health principles of the hierarchy of control apply here. And there's a lot of different ways to think about it. This is one way, but still trying to get as high up on that hierarchy of control. When you're talking PPE, you can end up with problems where you're like trading off heat risks with air quality risks, versus when you get up into administrative, or better yet, engineering controls, or trying to somehow avoid the hazard by, for example, changing working hours, or reducing people's exposure to outdoor air. Those would all be ways to make, more effective change. So just to wrap up, this is the same list as before. Magnification of existing hazards, have to think beyond the immediate predictable health impacts and start thinking about all the ripple effects on people's health, and all the ways that people's total exposure from both their work and their community can build on each other and magnify hazards. And then sometimes when you just talk with workers, they're like, okay, here's what we want to know next. Like, we want these emergency alerts, we want audio alerts. Those are things we can do, and it may not make a huge difference in the near term, but it can make a big difference in terms of sort of increasing the awareness level and getting workers engaged in the solutions. So I think that is all I've got for now, and would love to hear people's questions.
Thank you so much, Dr. Solomon. It's both scary, but also hopeful that there are paths that can be followed to reduce the harms of these three different sets of disasters that we face now and are likely to face more often in the future. There are a number of questions here. I don't know how many we can get through, but one of the questions I would like to start off with is about incentives. You touched on that very directly in your talk, and we can talk about how to create incentives for people to develop policies and pass legislation, and for employers to be informed of what is necessary in order to prevent harms, to arm the different agencies that go to disaster areas and know what to deliver to first responders and other people who are there in cleanups. It seems like workers is another area that would be really good. And I think your suggestion of involving workers in the solutions is very useful. Can you just say anything more about what may be incentives to help workers take care of themselves? I don't mean putting it on their shoulders, but in combination with the resources being developed and also their participation in the use and delivery of different solutions. Can you say anything about that? Anything more? You know, it's a bigger issue that sometimes the disincentives cause them to say, I'm not going to do that. I'm going to keep working.
I think I want to be very careful about not putting the burden on the workers here. I think that, you know, it is critical for workers to understand the risks and to have a role in thinking about what solutions can they feel can be effective for them. But there are and also sort of listening to the workers about what they feel works. Like you know, with cooling garments, which was mentioned on one of my slides, there are all these technologies now and efforts to create things that, you know, could articles of clothing that might be more cooling, cause evaporative cooling or other kinds of cooling. And you know, and that can be challenging for workers in some industries. I had some pictures of farm workers there. They often tend to be pretty, you know, have long sleeves and fair amount of clothing on, and that's often for you know, to protect their skin from irritation from the plants. And so, you know, you have to ask them what works for you. You know, would you wear this cooling t-shirt? And if, you know, if the answer is no, the answer may be no. And then you have to kind of go back and think about other engineering solutions where the answer might be yes. And same kind of thing, we, you know, hit that a little bit with piecework, where a lot of workers actually want to get paid piecework because they feel that they actually earn more money that way. And you know, and I get that. I mean, you know, if you're economically, you know, sort of just struggling to get by, you don't want to lose that income. And so then the question is, okay, is there a way to keep that income and get that, you know, make sure that the workers are getting those breaks and the water and, you know, so forth. So it pretty much just helps to understand like what's realistic, what will actually work with the population.
Critical.
Important, because if you don't, you know, don't ask people what's workable, then you can end up in this thing of, you know, oh, well, we gave the workers a shade structure over there and they're not going over there to use it, so it's their fault. Well, maybe not, you know.
Clearly we need to work harder on that and to touch all points of help. So you've done a great job of outlining things that we can be doing more. I want to make sure I ask you at least a couple of questions that have been posted here.
Yeah, there's a lot of great questions.
Yeah. So what advice do you have for how we should incorporate climate medicine into patient care? Maybe that's a touch point where it's incorporated into, you know, primary care.
Yeah, so, you know, let's see. So you mean how climate change is?
Well, how to take care of yourself with these dangers. If you have a patient who has exposures like this, could it be incorporated in occupational medicine or just regular medicine, primary care, as more of an educational and monitoring kind of thing?
Yeah, I mean, I think it should all of these things need to be incorporated into into primary care and into occupational and environmental medicine. We need to be asking about exposures to heat. We need to be asking about exposures to wildfire smoke. When we work with employers, we need to be asking about their emergency plans and their heat illness response plans and all of those things to make sure that that's all happening. And we also need to be thinking about for our own employees in our own communities what climate hazards we're facing locally. There was just a Sutter hospital evacuation in Santa Rosa 2 weeks ago, right? 2 or 3 weeks ago, due to flooding. So it's not, right here in California or anywhere, we can be dealing with, climate change hazards pretty much from one day to the next. And so we need to be aware of that.
Great. Let me ask you another question of the many that are here. Do you have any examples of acclimatization schedules? Have you seen any?
Oh, I've seen some. Yeah,
Climatization.
they're out there. It depends a bit on the job, but the basic concept is to, with some kinds of jobs, it's just, a matter of having somebody work, a half day instead of a full shift. And then you have them do something else in a cooler environment for the rest of the shift. In other cases, it's just more frequent breaks or scaled back work. But I'm not sure I've seen a one size fits all acclimatization schedule, but it is the kind of thing that should, I'm sure there probably are examples out there, and others maybe on this call that know more than I do about those or have some good examples.
Great. Is there a long-term mental health consequence of climate-induced displacement and loss of livelihood in vulnerable populations worldwide? Have you seen that?
There's a whole field of climate psychiatry now, and there's a great group called the Climate Psychiatry Alliance, worth Googling them and checking out their website. And they have a lot of useful information on the Climate Psychiatry Alliance website. And actually a lot of the leadership of that organization is here in San Francisco, and affiliated with UCSF, in fact. Yeah, there's entire new terms that have been coined, one of which is solastalgia, which is the grief that people feel about the loss of some of their favorite places, like, for example, after communities get flooded, or even anticipatory grief of people who are anxious that places that they love may burn in a wildfire, for example. There's a term called eco-anxiety, which is about the fear of the impacts of climate change on our own generation and the next generation in particular. So there's a lot of long-term effects, and then there are definitely long-term sequelae from things like displacement. There have been studies looking at many years later, following like the survivors of displaced survivors of hurricanes, floods, all kinds of climate disasters. The Camp Fire, 2018 Camp Fire in California, a lot of those folks are being followed over time.
This
And
is really great
unfortunately, it
information.
doesn't go away. And in some areas like the Gulf Coast, they keep getting hit. So, they had Hurricane Katrina, then 3 years later, they had the big BP Gulf oil spill. And then a couple of years after that, they had another hurricane, and it just, it's one thing after another.
One final question. Can you talk a little bit about the insecurity of drinking water available from climate changes like flood or drought? Is there anything that you have researched that have talked about, what the insecurity is about drinking water?
Yeah, drinking water can get impacted in a lot of different ways. And one of the things I mentioned, the campfire 2018 up in Butte County, California, that destroyed the town of Paradise. And one of the things that happened after that was that there was a discovery that the drinking water for the entire water systems of these towns had become contaminated. Um, uh, Oddly enough, with benzene, which is a known carcinogen and was not something that was thought to be expected. In fact, I got interviewed by some newspaper right after the campfire and asked whether there was going to be a drinking water problem. I said, oh, no, I didn't think so. Maybe there would be some runoff into the reservoir. And so there could be some issues of microbial contamination. I didn't expect benzene, and it turned out that's what happened. And it was, whole big investigation as a result of that. That turned out that that these systems go negative pressure and start sucking in contaminants from the smoke, and then those contaminants adhere to the biofilm inside the drinking water pipes. And once the stuff is in the biofilm, it oozes out, leaches out into the water for months. And so as I said, there's nothing exactly new with climate change, but there's always a twist. There's always something that surprises us. That's some kind of ripple effect that's unexpected. And so that's one of the things that I think is going to keep happening over time.
Well, Dr. Solomon, we so appreciate the time you've taken to educate us on 3 really scary scenarios and ones that we really need to prepare for and do a lot more work to protect workers and to enforce new legislation to generate new protections, because we're dealing with this and we'll deal with it more in the future. So thank you so much for joining us today. Thank you so much.